Thanks, Mary. We have the privilege of addressing you right after lunch in a windowless room with all those Klieg lights right at us. I think probably the best place for me to start is a little bit about the National Housing Trust. So I run a place called the National Housing Trust. We engage in housing policy. We're an affordable housing developer, and we do lending. And we operate properties, about 4,000 units up and down the East Coast and in Chicago. And we've developed about 25,000 apartments all over the United States for ourselves and others. And I think probably the next question you're probably in your head is, why am I here? And that's a good question. As we developed housing in the last 15 years, we were certainly focused not on the health benefits that accrue to that housing, because that wasn't our focus, right? Our focus was to help people who couldn't afford affordable housing to get into affordable housing. And we did that through policy and practice. And it was really kind of accidental that we began to hear from residents themselves on an anecdotal basis that once we rehabbed their housing, there was a benefit that we hadn't anticipated, which of course was, as you know, things like reduction in asthma. It's all anecdotal, comfort living. We took this property in Southeast DC almost down to its studs, and it became the first green apartment complex in DC. And the residents there who had a bake sale to save their housing, it's called Galen Terrace, would come up to us and they'd say, you know, it's so great that I have this housing because, and I expect them to say, because it doesn't cost very much. But instead they would say, you know, my son's asthma doesn't seem to be as much. He's going to school more. And then after that, we put in recertified carpets and we put in chemical-free cabinets. And again, this anecdotal evidence. And so this has been going on in my head for about a decade. About the time Obama came in, we decided to do more work on energy efficiency, and we started talking to HUD about weatherization funds broadly being brought to affordable housing, and use some of these health benefits as some of the discussion. And I will say, I don't know if you all have your stuff, but towards the end there are some materials that I provided that kind of give more than an anecdotal basis for the very notion of certainly the strong correlation, if not the cause and effect, between energy efficient affordable housing and health outcomes. So the Southwest Minnesota Housing Partnership has done a longitudinal study now showing a reduction of something like 33% in chronic asthma over 5 to 6 years after the energy efficiency retrofit of its properties. And it's supposedly, they say this anyway, eliminated chronic bronchitis. I find that a little bit, but that's what they say. In Mission Creek in San Francisco, Mercy Housing has put together health supportive services that are extending people's stays an extra 2 or 3 years so they don't have to go into assisted housing or into nursing homes, and they are saving the city $30,000 a year. And I'm reminded of the Mercy housing example. My brother ran a large healthcare company. He's now retired, and if this is being recorded, I guess it is being recorded. I won't say much more about that. But anyway, I sent Sister Lillian, who's on my board from Mercy Housing, out to meet my brother and had him tour the property. And I wanted to know how my brother reacted to the fact they were saving so much money and there were better health outcomes from the people who were living in affordable housing. So after he left, I asked Sister Lillian how it went. She said, well, it went very well, but I had my hand in his pocket and he had his hand in mine. And I think that's part of the conundrum here, right? It's allocation of resources, and how do we figure out a way of making sure that the benefits that are so obvious from the speakers we had this morning, from Raphael and from Orlando, how do we make sure that there's really a benefit, and how do we pay for those? So the last 5 minutes, I want to talk about something that I'm not sure you could emulate. It might be an analog, but it's a suggestion. It's a strong suggestion. When we were doing energy efficiency retrofits, we were figuring out it cost about an extra $3,000 an apartment to do an energy retrofit. There's no economic reward for doing an energy retrofit. The HUD still charges you X%. There's no economic reward to the owner. The tenant's utility bill, it costs to HUD. HUD might get some money back, but you're not getting, there's no incentive for the owner necessarily to do that. On the other hand, we knew it was good for our tenants. We knew it was important for them to realize those savings. So we thought about what can we do outside of HUD to bring financing to this that won't cost us $3,000 a unit. Pretty simple question, right? So we started exploring sources of financing that were not housing dollars. And we determined that private investor-owned utilities across the United States expend $7.5 billion a year in energy retrofits. What do they retrofit with $7.5 billion a year? They retrofit all kinds of buildings. Schools, hospitals, not this building, it's too old, but other kinds of buildings, your home. Guess who doesn't get any of those dollars? Poor tenants. They get a scant 0.3% of those dollars, even though they contribute to the funding for that. And if you take a look at your utility bill, you might see a little bit like 20 cents a month, 30% a month. It goes into a pot. They don't call it energy efficiency, but that's what they use. And it's $7.5 billion, and it's going up. So we decided to do a campaign. And it's a simple campaign. We joined with Natural Resources Defense Council and the Energy Foundation in California, and we declared energy efficiency for all. And we're in 12 states, California, Minnesota, Illinois, Missouri, hope I get all these, Ohio, Rhode Island, New York, Pennsylvania, Washington, D.C., Maryland, Virginia, Louisiana, and Georgia. And in those 12 states, we've now secured over $200 million for energy efficiency in affordable multifamily housing. That was conducted in 2 years. And it was based on the fact there were two reasons. One, residents weren't getting their benefit. And two, the utilities needed a place. They needed a place to plant their, so remember, I think it was Helen who brought up co-benefit. I forget who it was. Somebody brought up co-benefit. That, it was a benefit to the utilities that they didn't even understand they needed until we went to them and said, you need a low-income program. Guess what? If you're low-income in the United States, you're probably a renter. Not necessarily, but probably a renter. So why don't you figure out a program that works for rental housing? And we'll help you figure out a way to design it, and we'll help you figure out a way to implement it. So it's not as easy as I described. It takes a lot of time, a lot of resources. It was foundation funded. The collaboration is in its third year. I'm actually leaving this room today to go back to New York we have a quarterly meetings every 3 months. But I do think there's probably something there where we're just scratching the surface of what the health benefits are of energy efficiency. And wouldn't it be interesting for the utilities to start thinking about indirect benefits? And there's a term for this, actually, indirect cost for their and whether they could get credit for that. And couldn't you figure out a way in your own work to figure that out? Because I do think that there's something with respect to social determinants. So I'm going to close there because I want to make sure we have a lot of time for it. Do I? Okay, great. Oh, good. I don't have any sense of it. So I won't close there. Let's talk about the Dodgers. Okay. So one way to think about what you're going to be doing is thinking about ways of working with good partners. And I think when you're thinking about place, housing is where the people live. It's where they're going to be. If they have any kind of illness, any kind of something going on in their lives, it's going to happen in their home. We have nursing services at 3 of our 17 properties in Virginia, and the nurse there does not provide health care. She knocks on doors, and she asks people how they are. And that's all she does. I mean, she does other stuff, but really what's really going on there is we're linking them up. And people love that. So that's where she's going to hear about that person's problem way before her doctor. Because their person's going to complain to her neighbor, and their neighbor's going to talk to our resident service squad. So there's a thought in my mind that if you want to start doing this kind of thing, think about the home as being the place where it all happens. And then think about where you would work, who would you work with. It doesn't have to be with a multifamily, it could be with anybody in your community, but that's where it happens. And so the partnership to me, and maybe we should be adding healthcare partners to energy efficiency for all. I mean, that would be a fair thing to say to me. I mean, I do think there's something about that that would overlap. So that's important, and getting leaders in the states, in each state, a state-by-state strategy rather than a national strategy for obvious reasons. If that's not obvious, I will say this, I think the further one lives from Washington, D.C., the more optimism they have in federal government. There's a direct correlation to that. I think it's not likely that pay for success at the national level is going to solve our problems. I was at a Stanford meeting over the summer. I think pay for success constitutes like 1/2% of social investment. It's never going to constitute 20% of social. It's just not. So you have to think about what you're going to do beyond pay for, and it's great. Pay for success is great, okay? But it's not a panacea. And you need to think about something beyond that. So I am going to stop there, and I hope that we have more time for questions. Thanks.